Okay.
Hi, my name is Olivia Petritz. I'm an assistant professor of zoo and exotic animal medicine here at NC State. I've been here since 2017, and my research interests include exotic animal therapeutics, which is a broad category, so within that specifically birds and specifically backyard poultry, and also exotic animal imaging.
And I'm Julie Balko. I'm an assistant professor of anesthesiology. I've been here at the CVM as an assistant professor since 2018. I did my training here as well, so I'm a little bit of a long timer. My research interests are non-domestic species, particularly objective evaluation of anesthetic and analgesic techniques in non-domestic species.
So we have done several research projects, we've submitted several grants, but yeah, I think we have very similar interests as far as non-domestic or exotic animal species. So yeah, we're just here to talk about some of the previous projects we've done, which include, let's see, we've done rabbits, backyard poultry, geckos.
Done some squirrel work with some collaborators at Duke.
Yep. Yeah. So I think that's some of these studies are, I guess, relatively basic, just looking at different drug protocols, specifically sedation and anesthetic and analgesic drugs in exotic animal species, but there is still a lot to learn in those, and I think a really growing field. So there are a lot of other researchers at different universities that have either captive populations of some of these species or they're client-owned species. But yeah, I think there's still a lot of questions out there about what drugs are safe to be used, what are potential side effects, are they even effective in certain species? So those are some questions that we're looking to answer.
Yeah, so one project that we have started going, we've gotten some pilot data. There's an anesthetic and reversal agent that's used really commonly in avian and other domestic species called flumazenil, that we're not really sure what the appropriate dosing is, so people just kind of anecdotally extrapolate from other species to figure out what appropriate dosing looks like in a bird. And so our hope is to refine that dosing to do some pharmacokinetic and pharmacodynamic studies to be able to better refine what that looks like for a bird.
Yeah, so again, very simple research question, but I think an important one. Like, we use that drug flumazenil in many different species every day, as well as many other exotic animal practices, without a lot of evidence behind why it works. Like, we have a lot of anecdotal evidence to say that it does, but certainly no safety or even dosing trials. So I think very important information to get out there, good clinical questions to answer. So several of these projects that we've been worked on have been first authored by either a student or a house officer. We both work with residents and certainly our interns here at the CVM, so I think that's another important component of this, like getting them exposed to different research projects and being able to work with them and mentor them in the process.